Hi, my name is Sammy, and today I'm going to teach you how to take a manual blood pressure. So the first thing I'm going to do is introduce myself, identify the patient, and explain the procedure. Hi, I'm Sammy. I'm going to be your medical assistant today. Can I get your last name and date of birth?
Kiefer, 5/22/85.
Alright. And we are going to take your blood pressure today. Is that okay?
Yes.
Alright. So I'm going to first make sure that the patient is sitting or laying down before I put the cuff on. I'm also going to select an appropriate arm, so making sure that there's no injury, disease, or they had no
Okay.
I'll just mastectomy on that arm. And then making sure that the patient legs are uncrossed as well, and selecting the correct cuff size. So to measure the cuff size, you're going to do the 80-20 rule. So making sure that it's 80% of their arm and then covering 20% of their arm. So this would be the appropriate cuff size. And you're going to want to go ahead and find the brachial artery to know where to place the cuff. So once I found that, I can go ahead and put the cuff on. And then once the cuff is on, you're going to want to go ahead and attach this to it. And then you're going to want to make sure it's about 1 inch above the brachial artery site. And then you're going to want to find the radial pulse. So that's going to be on the wrist. And then once you found that, you can go ahead and pump up the cuff until you can't feel the radial pulse anymore. So I can't feel it anymore at 140, so I'm going to go ahead and deflate the cuff. And you're going to want to wait a minute before taking the pulse again. So since I got 140, I'm going to go ahead and add 20 to that to know the peak inflation level. So that would be 160. So once you go ahead and wait a minute, you're going to take your stethoscope and place that on the brachial pulse site. I'm going to place that on the brachial site. And you're going to want to pump the cuff up to that peak inflation, so that would be the 160. And then you're going to listen for the first sound that you hear, and that's going to be the systolic number, the top number, and then the last sound is going to be the diastolic, which would be the bottom number of the blood pressure. So I got 106/86 for the blood pressure.
It's in range.
And a normal one would be around 120/80. So once you have that, you can go ahead and deflate the cuff and also remove the cuff. And if you are needing to redo the blood pressure, you just have to wait about a minute to do that. And then you're gonna want to go ahead and clean your stethoscope. So I have an alcohol wipe here. Just gonna clean that. And then I would go ahead and wash my hands. Just gonna grab some hand sanitizer. And also making sure to wash your hands before taking the blood pressure. And then you're just gonna want to document that into the patient's chart.